everyone on our panel, and thanks all of you again for hanging in there. We would like to encourage you to dig deep and think about a few questions you may have for this panel before we break for the day. And while you're thinking about that and gathering your thoughts, I'm just going to suggest that we're engaged in a little bit of a cross-sector exercise here in this room. We have researchers and academics in here. We have government officials. We have practitioners. We have advocates. We have federal government officials and citywide people who focus on city issues. And I think it's fair to say that we all have a shared goal, and that is for broad-based systemic change that can improve the health in this discussion of the 0 to 5 population. And I think we've heard a lot of great research about what we know and what we don't know and what can confirm some of our suspicions. We've heard a lot of great promising practices, and we've heard a lot of implementation of programs and policies on the ground that are having traction and changing people's lives in ways that are really exciting and powerful. And I think the question for our panel is, how do we get at the process that we need to engage in as a collective, bring all of our talents to the table? How do we get from these episodic, place-based success stories to the kind of system change that I think all of us in this room are interested in? And I think the ingredients that we've heard are very challenging. We are talking about building personal relationships. We're talking about investing the time it takes to build trust across sectors among people who don't work together very often. We're talking about patience for incremental change, that it's not all going to come at once. We're talking about very site-specific and local changes, because that's the nature of the beast here, where there is no one-size-fits-all, there is no off-the-shelf answer. So we're talking about a pretty tricky, not very easy approach to a pretty tricky problem. And my question for the panel is really about how we get from the episodic to the system change. And I would venture that one key ingredient to that is leadership. And all of you here are leaders, and all of you here have referenced other leaders, like, for example, the mayor of New York City. But my question is, as you think about, Allison, for example, the infrastructure that you've built in your system to begin to tap into all the talents at these different levels to execute good programs and good policies, what would you say about the leadership that's required for that sort of systemic approach? Or what is happening underneath the mayor's press veil, where he's getting a lot of attention for a soda tax or a big gulp or whatever? Who are the people, and what are they doing on the ground to kind of bring about this sort of systemic change that I think everyone in this room is interested in?
I can start. It's a great question, Liesl, and I think if we can solve it, then we are going to be golden moving forward. I think leadership is really key, and what we're finding is that those leaders may exist in different places in different communities. And so if we're thinking about how do we change some of these things in a move from episodic to systematic, I think it is coming up with probably a bookshelf, if you will, of options that people can, and organizations and communities can select from. So I don't think we're ever going to get to, if you can engage just one person, you're going to be golden going forward. But I do think we can probably get to 4 or 5 different types of cases and examples that could be spread and scaled, and really it becomes the process of engaging in that community or in that state or in that locality to pick the one that's going to best work. And if we as a system are providing the evidence for why those are the 5 that we think you should be looking at, and I think are then also open to the feedback loop that should be happening from those communities to strengthen those options, then I think that's how we're going to be set up to see this in a more systemic way, because we're setting up not only the sort of library, but also that feedback loop that will continue to inform that, shape that, make it stronger, and maybe perhaps even narrow it as we move forward.
So I'll jump in. I'll offer just sort of 3 ideas off the top of my head. The first one is actually in introspection for those of us, working in public health education, in terms of who are the graduates, that we're actually putting out there in the workforce. For so long, we're dedicated to training graduates to fulfill roles in academia or city health department. New York City Health Department is our biggest employer, at the CUNY School of Public Health. But we're living in a much more complex world, and what we really need is not just more people that we can talk to, and where we can kind of sing to the same choir, but we actually need to create agents of change across sectors. So the new public health, educational model is, trying to think about, where public health can be strengthened in all places, all industries, all sectors, and how do we prepare our students to assume those change agent or leadership roles in different places. And so I think it really calls into some fundamental aspects of our pedagogy and our intent. The second thing is, leadership is part of community readiness. I have been doing some work for a few years in low-resource communities where the initial idea was, we need to do something about obesity, but very quickly we learned that actually there's nothing we can do about obesity if there wasn't even the community readiness to address, health as an issue. And so we looked at integrating, this is through a active living research grant project, looked at how we can integrate youth activism with social marketing, business engagement, to actually shift the needle on community readiness, and we were successful over a period of 2 to 3 years. And so sometimes it kind of makes me think that, we, again, do we have the system's goals correct, at least in terms of the trajectory, what needs to be done. And I would argue that if we actually spend more time and effort on building up community readiness, that will go a long way in changing the leadership landscape locally and nationally. The third thing is this whole notion around, again, the demand-side strategies and how we create a social movement so that there is the integration of these bottom-up pressure and top-down strategies. So, recently colleagues and I published a paper, a commentary drawing a parallel between, what the obesity prevention field can learn from the gay marriage movement in the U.S. Seemingly totally disparate and disconnected ideas, yet if you look into the literature and the archives of how the U.S. gay marriage movement came about, there are clear lessons for how we can get better organized. And so much of the outcome of a social movement like the gay marriage movement in the U.S. Is a shift in leadership. And so I, again, I would just challenge all of us to think outside the box and look at fields and disciplines, outside of the traditional public health world.
I have I think, first question over here. Yeah. Please, go ahead.
Hi, good afternoon. I'm Patricia Fernandez. I'm with these conversations for a policy and advocacy organization. My question has to do with the implementation of policy.
And it's directed towards Ms. Jenny Clapp at the New York Department of Health. So in the implementation of your wellness policies in child care centers, it's basically a two-part question. One, how was compliance measured and evaluated? And two, when it comes to motivating factors, do you find that incentive-based programs are better, or fear-based, aka you have to pay a fine or you lose accreditation. I feel when it comes to implementing policy, this is a question that a lot of us have.
Wait, there was fear-based and what was
So there was the incentive-based, which is the positive one, and then there's the ones that if they aren't compliant, they get fined.
Well, so we have a violation-based system, which I'm not sure I would describe as a fear-based model. But, you know, we have the ability to enforce child care centers, and we're doing it for a lot of different reasons, for safety purposes. And, you know, I think that as far as public health goes, there's an extension of sort of an old school public health model around what you would consider health and safety. And now I think it includes obesity, chronic disease. So I'm comfortable with that shift of using the violations and the enforcement and the inspection system that we have as part of our jurisdiction over city health. And in terms of how compliance is measured, we have inspectors that are going into every center at least once a year. So we are able to track data that way. And I believe that that's how the evaluation that was published on the 2007 change was assessed. But I'm happy to share the papers with you. They were published just in the last year or two.
Thank you very much. Nico Pronk, Health Partners and Harvard School of Public Health. Great panel. So this is all about scalability, sustainability, making sweeping changes, if you will. And I think if you bring scalability and sustainability of solutions together, you're going to need a sustainable business model. And I would love to hear your thoughts about what such a business model could look like, particularly if we bring multiple sectors together.
I'm going to take a crack at that. Just because in our work, thinking about prevention more broadly, not necessarily specifically as it relates to early childhood, we've talked a lot about how a system approach would engage the various sectors that have a stake in the outcome, such that they would want to make upfront investments in both building that system and delivering those outcomes because it's in their own interests. And so for the purposes of our work, and Bill Dietz and others here have helped with that, you know, we've thought a lot about this question of a sustainable financing model for any of these types of interventions, and where some of these health and wellness interventions intersect with our healthcare delivery system. I think there's a lot of potential power there. And so we've talked a lot about ways in which we can draft off of the shift toward more value-based care, more integrated systems of care, to better embed prevention within that coordinated system to help do exactly what you're saying, to help sort of bring a new funding stream to the table that's consistent, not grant-based, not episodic, but rather has a business interest in the same outcomes as some of the public health advocates might share. I don't know if others have.
Well, I would just add that from my vantage point, there can be no sustainable business model if our definition of a multi-stakeholder approach is limited only to, you know, the public sector or the academic sector. I think that there absolutely needs to be a role for the private sector in crafting long-term solutions, and there are increasingly the recognition that, you know, a business that is geared towards health or has health as part of its value, you know, can be profitable even for the food and beverage companies. This is not to say that they shouldn't be held to account, they shouldn't be called to the red carpet if they do something bad, or that they should be allowed to do whatever they want. This has to be a strategic, coordinated, and managed effort with clear accountability mechanisms built in. But I think part of the effort in reigniting this conversation around building trust is to develop a space where such dialogue and accountability structures can begin to be built in a meaningful way, constructive way towards solution sets. And I think that there in my I have some favorite roles, things that the private sector working on corporate social responsibility should invest in. And one of the things that I would really like to see a cohesive effort across companies alongside the public and academic sector is a major investment in shifting social norms, whether it's norms around portion sizes, whether it's norms about the value and the pleasure of healthy products and wellness. Just imagine if we can pool the talents as well as the resources in a cohesive way. That kind of messaging campaign is going to be way more powerful than anything we can do with, NIH R01s. That just adds to, I think, what Lizelle has said.
I think, Lizelle, I think part of what we may be looking at the beginning too is sort of a dual strategy, because I do think we're faced probably with double payment at the get-go. Right, because we want to pay for what we want to see happen, and yet we have to pay for the current reality. And so I think where some of our strongest business cases may be in place and our strongest funding strategies for the long term may be is figuring out how do we leverage both the episodic grants, federal investments, whatever the case may be, and then think long term about the roles that organizations could play, whether that's the healthcare system, whether that's the education system. I think we've devised a system where if one sector gains, another loses. And there's going to have to be a shifting of the norms, a broadening of the pie, if you will, where a redistribution is not a loss, but rather a gain across shared goals and expectations. I think that's going to be critical for the business plan development that's going to lead to sustainable funding.
Look, I'd just add, really, as I mentioned in my remarks, the Affordable Care Act, I think, has been that aspect of the requirement for healthcare systems to maintain their not-for-profit status, I think, has been underexploited, underdeveloped. And I think it is a natural, both in terms of a sustainable set of strategies for communities. If you produce a healthier, you address some of the conditions that result in people needing the acute care system. I think that's a plus on the healthcare side, but it's also a plus in terms of the industries or businesses that are paying premiums, among other aspects of life. And education, I didn't speak about the public education system so much, but for school-age children and beyond, we're in the midst of, systemic change in school meals now in year 4 from the Healthy Hunger Free Kids Act, that even though it has its people sniping from the sidelines for the most part, there's unanimity in the professional community, pretty much, with one exception, about the efficacy of that. And what we're trying to do is, on our side, I'm very conscious of the role that government can play in engaging organizations that aren't part of government across the country. In this city, lots of organizations representing membership groups, but as well as policy groups, come together at a state level or a community level. Often those voices haven't been corralled, haven't been engaged. And so going forward from the place where I sit now, we're trying to see what else can we do at a state level so that there's more, regardless of who is governor or which party governs, what can one do to really elevate and sustain the importance of these kinds of strategies, whether it's healthy eating and for school children through the developmental years, or opportunities for income, because as I often say, you can't solve the hunger problem in this country with food programs. You really need a much fuller commitment to how do we engage people in constructive ways so they have incomes.
Thanks, everyone, very much for your time and attention. I'm going to ask Bill Purcell to come up and bring us home here.